Hey everyone! Welcome back to the Learning Stethoscope. Today, we're going to break down the anatomy and biomechanics of the peroneal muscles, focusing on how they work, why they matter, and how they keep the ankle stable during movement. Let's start with the anatomy. The lateral compartment of the leg contains two main muscles, the Peroneus longus and the Peroneus brevis. Both muscles run down the outer side of the leg, curve around the lateral part of the ankle, and then insert in the foot. The primary function of these muscles is foot eversion, meaning they help the foot to go out. This means that they play an important role in stabilizing the ankle and helping prevent inversion sprains. Now let's look at each muscle individually. The Peroneus longus starts high on the leg. It originates from the upper two-thirds of the outer side of the fibula, along with the intermuscular septum, and sometimes from the lateral condyle of the tibia. As it travels downward through the lateral compartment, its muscle belly gradually turns into a tendon, at about 3 to 4 centimeters above the tip of the fibula. At the ankle, the Peroneus longus run posterior to lateral malleolus, in a small bony and fibrous tunnel called Retromalleolar groove, along with the Peroneus brevis tendon. From there, the Peroneus longus takes a unique path. It passes inferior to the peroneal tubercle, then dips under the cuboid bone through the cuboid tunnel. After that, it travels diagonally across the bottom of the foot and attaches to the plantar base of the first metatarsal and the medial cuneiform bone. Now, the Peroneus brevis takes a slightly different path. It originates from the lower two-thirds of the lateral fibula, as well as the intermuscular septum. As it travels downward, the muscle turns into a tendon about 2 to 3 centimeters above the tip of the fibula. Then, at the ankle, the Peroneus brevis tendon also runs posterior to the lateral malleolus in the same retromalleolar groove as the Peroneus longus. From there, it continues along the lateral surface of the calcaneus, passing superior to the peroneal tubercle. And finally, it inserts into the tuberosity at the base of the fifth metatarsal. Let's take a better look at how these tendons interact with each other. At a lateral view of the ankle, we can see both tendons, Peroneus longus in blue and Peroneus brevis in green, running together behind the lateral malleolus and inside the retromalleolar groove. At this point, they actually share a common synovial sheath. If we take a cross-section of the ankle, we can better see the retromalleolar groove. Inside the groove, we have the Peroneus brevis tendon, shown here in green, who sits more anterior and medial, and the Peroneus longus tendon, shown in blue, that sits more posterior and lateral. Surrounding both tendons, highlighted in purple, is their shared synovial sheath. Now, notice that the Peroneus brevis sits deeper and right up against the fibula. This is an important detail because it means that when the muscles contract, the brevis tendon can get squeezed or compressed between the fibula and the Peroneus longus tendon, making it more vulnerable to problems like longitudinal split tears, tendinopathy, and tenosynovitis. The shape of the retromalleolar groove also influences how the tendons behave. Studies show that groove morphology varies. About 82% of people have a concave groove, 11% have a flat one, and around 7% have a convex shape. This is relevant because a flat or convex groove provides less containment, which makes tendon subluxation or even dislocation much more likely. We can see this clearly in the image. When the retromalleolar groove is concave, the tendons sit securely in place. But with a flat or convex groove, the shape doesn't hold the tendons as well, making it easier for them to slip or move out of position. Now, look at what happens to the synovial sheath just below the tip of the fibula. The once common synovial sheath splits, and each tendon continues its course with its own individual sheath as they travel along the lateral wall of the calcaneus. There's one last feature to highlight. These tendons rely on two retinacula, meaning bands of connective tissue, to hold them in place, giving them stability. There is the superior peroneal retinaculum, who is the main structure keeping the tendons securely seated inside the groove, and the inferior peroneal retinaculum who supports them further down near the calcaneus, helping maintain proper alignment as they continue toward their insertions. And if we take another cross-section at the level of the lateral calcaneus, we can see both tendons along with the peroneal tubercle. The Peroneus brevis sits above the tubercle, and the Peroneus longus runs below it. This is another key area for pathology because the shape of the peroneal tubercle can vary, and when it becomes enlarged or hypertrophic, typically more than 5 millimeters, it can create mechanical impingement on the Peroneus longus tendon, which can be a source of pain. Now let's move on to biomechanics. Because the Peroneus longus and brevis sit in the lateral compartment of the leg, when they contract, they pull the foot outward. This makes them the main contributors to eversion, just as we mentioned earlier. They also have an important secondary action. Notice how both tendons pass behind the lateral malleolus. This means that they travel posterior to the ankle's axis of rotation, shown here in the red circle. So when they contract, they don't just avert the foot. They also help with plantar flexion, which has an important role during gait. Although the Peroneus longus and brevis work together, each tendon also has its own biomechanical role that contributes to normal gait. Starting with the Peroneus longus, its main action, as we've already discussed, is foot eversion, but it also has important secondary functions. One of these is plantar flexion of the first ray. Since the Peroneus longus inserts on the base of the first metatarsal and the medial cuneiform, when it contracts, it pulls the first ray downward and contributes to an efficient push-off during gait. This plantar flexion of the first ray helps turn the foot into a rigid lever, allowing for a strong and efficient push-off and better forward propulsion. This means that when the Peroneus longus is weak, push-off becomes much less effective. That's why rehabilitation for peroneal tendon disorders shouldn't focus only on eversion strength. It also needs to include exercises that improve first-ray control and drills that reinforce a strong, efficient push-off. Last but not least, remember how the Peroneus longus wraps underneath the foot, passing beneath the cuboid and attaching to the plantar base of the first metatarsal and the medial cuneiform? Well, because of this unique path, it acts like a sling that supports both the medial and transverse arches. When it contracts and tightens that sling, it helps maintain the height of the arches and prevents them from collapsing under load. Now let's look at the biomechanics of the Peroneus brevis. Just like the Peroneus longus, its main action is foot eversion, but the brevis is especially important. Because it attaches at the base of the fifth metatarsal, it has a short and strong lever. When the Peroneus brevis contracts, it can pull the foot outward very directly and very fast. So when the foot suddenly starts to roll inward, the Peroneus brevis can react almost immediately and stop that movement. This fast response is a crucial protective mechanism for preventing inversion ankle sprains. It's particularly important during things like quick direction changes, cutting movements, walking on uneven ground, or landing from a jump. If the Peroneus brevis is weak or slow to activate, the ankle loses this quick protective response. And that makes recurrent sprains and chronic ankle instability much more likely. In ankle sprains and chronic ankle instability, rehabilitation should prioritize targeted strengthening of the Peroneus brevis so that the patient is able to quickly evert the foot and stabilize the ankle, thereby reducing the risk of recurrent inversion injuries. As we mentioned earlier, the Peroneus brevis also has a secondary role in plantar flexion. Although this contribution is small, it is functionally important during gait, particularly for assisting push-off and maintaining overall ankle stability. And that wraps up the anatomy and biomechanics of the peroneal muscles. Thanks for watching. If you found this helpful, don't forget to like, share, and subscribe to the Learning Stethoscope. I'll see you in the next video.